What do you do when you come home and you're hungry for a snack and you want to have something a little bit healthy and there's some leftover chicken?
Programs like this one. McClure Middle School stays open after hours to offer students free fun and supervision.
I finally realized how fractions will come in handy in life. How fractions come in handy in life. That's why I never wanted to do my homework. I never thought it would come in handy.
This is right.
A school levy passed by Seattle voters makes classes like this one widely available.
I call it creative cooking, but we also do a little nutritional information. Remember how we cut? Remember how we did it before?
Janet Bell could have used help like this herself. She gave up a career as a scientist to stay home with her children.
It's always been very difficult to figure out that piece of what to do with your children if they're pretty young and they can't be on their own for a couple hours after school. When I was growing up, we had a lot of neighbors at home, so when you came home as a middle school child, you know, there were people kind of monitoring, and there's some accountability in your community. Nowadays, there is nobody. They're all working, so I think the kids are left to their own devices.
Let's go! We're going to do that number!
Many McClure students enjoy an after-school drama program. For others, it's a chance to get a little help with their homework. The Seattle levy also pays for buses to take after-school students home at the end of the day. These programs are effective. Each dollar spent on them brings back up to $13 in educational improvements and reduced delinquency.
Face it, moms, we can't all have health care. We're not Swedish. But we can do right by our kids and avoid pesky medical bills with a little well-placed padding. Remember, an ounce of prevention is worth a pound of cure. Till next time.
Just pray your child doesn't get really sick. That's what many American mothers say. Sharon Dorset knows why. Her son, Zachary, looks like a happy, healthy boy. Happy, yes. But Zachary Dorset has a rare disease called primary immune deficiency. The problems showed up soon after he was born.
When he was 3 months old, he got pneumonia, and it was really bad, and he was sick for months and months.
He needed continual medical treatments. He also suffered from asthma and other illnesses.
He would go to the doctor probably once a week, twice a week sometimes more than that. Zachary being sick all the time just was frustrating, and it was hurtful. You know what I mean? Just watching him suffer sometimes was just horrible.
Though the Dorsets had health insurance, it didn't cover everything. There were the co-pays and expensive medicines.
Antibiotics have always been a big part of Zachary's bills.
Sometimes the insurance company would refuse to pay for them.
They would say, he's been on him too much. We won't cover him. Medical bills started scaring us probably when he was 2.5. His expenses are what most people pay for, you know, a car or a house sometimes. We owe 10% of that. They pay 90 and we pay 10.
Each year, the Dorsets must pay between $10,000 and $20,000 for Zachary's treatment and medicines.
About a year and a half ago, he was real sick. He'd had a sinus infection probably for about 6 months.
They stretched their credit cards to the limit and refinanced their home, but were not able to keep up with the bills, even though Zachary's father works 70-hour weeks.
He would just work more and more and more and more and hope that it would make a difference. There's nothing that would stop either one of us from making Zachary better, whatever we had to do.
But eventually they were forced to file for bankruptcy. A New York Times story helped the Dorsets keep their home, but life is still a struggle. And recently they learned that Zachary's sister has the same disease.
I think people need to understand that they're not any different than me. They're just one accident away from living the same kind of life that I'm living. I think it's just really important that people come together. We all have a voice. And, when it comes time to where, hopefully the government will talk a lot more about universal health care, we all need to use our voice.
Family practice, Lisa.
Millions of other families are at risk as America's health care crisis deepens. Today, medical bills are a factor in half of all bankruptcies. 2 million Americans a year are affected, 20 times as many as in 1980.
Hi, Maureen. How are you? Fine, thank you. Things going well?
Maureen is one of 46 million Americans who are uninsured, an increase of 6 million in the past 4 years.
If you look at the national statistics, patients who have no insurance are 2 to 3 times more likely to die when hospitalized with the same illness as somebody who has insurance. I mean, it definitely affects their health. There's study after study to show that. We know that that's the case. And I see it myself. It haunts you, really. So the situation is you're working the full-time at daycare now?
Yes.
Any chance they're going to give you health insurance?
Not right now. They are talking about it.
18,000 Americans die each year for lack of health insurance. In many other cases, the cost of deductibles puts treatment out of reach.
There have been times where people have talked me out of getting a certain test done or doing a certain thing. And there's one case of a patient who died because of that. And you don't get over it because you realize that you should never have listened to the patient begging you not to send them to the ER. Had a good day at school? Yeah.
9 million American children have no health insurance.
Wanna listen? Are you still ticklish?
Dr. Deborah Richter remembers a patient she was too late to save, a young man who died of diabetes at the age of 21.
And 2 years later, his sister had a baby, and she also had diabetes, so the baby was born deformed.
Both the baby and the sister also died.
So this mother lost her 2 children and her grandchild within 2 years' time. And it was mostly because they went through many periods of their lives without insurance.
During those periods, they couldn't treat the diabetes, causing complications that eventually killed them.
After you see enough of those cases, and I saw so many, you can't help but get involved. I mean, there's really no other way but just to remedy the system.
It would be hard to argue that the system isn't broken somewhere. America spends far more per person for health care than any other country. We should be the healthiest country. Instead, we're way down the list.
Our outcomes are really worse than any other industrialized country. So if you look at life expectancy, maternal mortality, if you look at infant mortality, if you look at almost any health outcome, we rank far below the other industrialized nations. And in fact, the WHO says that the US ranks down with countries like Slovakia and Costa Rica. We don't rank up with France and Japan and Germany. And that's really an outrage.
One way to start catching up and actually save money on health care would be to fully insure all children through a program like Medicare.
It's fairly inexpensive to insure all kids. And the reason why is because most kids are healthy.
It would also remove one big worry from American mothers' lives. Providing paid sick leave would remove another.
According to government statistics, fewer and fewer companies are offering workers paid sick days.
It is the duty of anyone suffering from a contagious disease to remain at home until the doctor feels it is safe for him to go out among other people.
More than half of all American workers get no paid sick leave, so many go to work ill, infecting others.
This is an enormous problem. It's called presenteeism. Can you imagine if you go to a restaurant and your waitress, for example, is really, really sick with a bad cold? She couldn't afford to stay home because she didn't have a single paid sick day. So she comes to work, she passes you your burger, you get a cold. This is a problem.
Evidence shows that children recover faster from illnesses when their parents are there to care for them.
They get better faster from chronic diseases. Their asthma gets under control better, their diabetes, their epilepsy, their acute injuries or illnesses, their vital signs are better. Their every measure of heart rate, temperature, etc. gets better faster.
But all too often, parents can't stay home.
I've seen quite a few moms lose their job because they've had to take off to be with their sick children.
Almost all countries guaranteed paid sick leave, including time to care for sick children. Among industrial nations, only the United States does not. The Healthy Families Act, recently introduced in Congress, would change that by providing paid sick days to all workers.
It's not rocket science. What we need to do, we need to provide workers with paid sick days so they can take care of themselves, take care of their children, take care of elders.
Ladies, I just got an email from a mom complaining about her little Johnny's daycare. Yikes! That is rough. But you know what? My mother never sent me anywhere fancy and I turned out fine. Oh!
Okay, you ready to go bye-bye?
For the past 6 months, Alfreda Oxley has seen a lot of her 2 sons.
Hi, Mom!
She's been able to pick up 11-year-old Hassan when he gets out of school.
School's fun today.
And he's been a big help to her, especially with his younger brother, Makai.
Yeah, you happy, huh?
Hassan really loves Makai, and Makai loves Hassan.
Alfreda has always worked full-time, but she took time off when Makai was born. She combined odd jobs, accumulated leave, and her savings to get by.
I didn't think 6 weeks was enough time. I wanted to bond with my child, and I wanted to, to get to know him before I shipped him off to someone to watch him, that he wasn't comfortable with.
But now, her money gone, Alfreda must return to work and find affordable childcare for Makai.
I worry a lot. Because he's a newborn, it's like maybe $600 or $700 a month. And it's like, I can't afford it.
But come with me, it's a summer night so lovely. How can you be talking and sleeping and dreaming? We should be laughing and scheming. Come along, maybe I will sing you a moon song. Not just any moon, it's a rare moon. It's the banana moon.
Who can raise their hand and tell us what month it is? Iris.
March.
It's March. Can we all say March?
There's no question that high-quality childcare can make a big difference in children's lives.
This is just an incredibly important time. The brain is growing at its fastest rate. How well a 5-year-old is prepared for elementary school accounts for nearly half of how well they do in high school.
But childcare like this costs more than $1,000 a month. Even the average cost of childcare is higher than the tuition at a typical state university. Despite the cost, few centers offer truly high-quality care, and some provide care so poor it is actually harmful to children.
Automation enters the nursery in this playful prediction from Budapest. One nurse at a central control panel will be able to manage a whole brigade of babies, and the tykes will spend happily antiseptic infancies untouched by human hands. They'll even be tucked into their cribs by remote control.
We're not this miserly, not yet. Though few tasks are more vital to our future than caring for young children,
Good morning, Kyra. Good morning. Good morning. How are you?
the average childcare worker in the United States earns only $17,000 a year. Grandma's House Child Care Center has been a daytime home for South Chicago children for the past 10 years.